But first at 5, some staggering numbers for you. We are 1 week into December, and already the country has recorded more than 1 million new coronavirus cases. And in that time, more than 14,000 Americans have died. Glad you're with us on this Monday afternoon. I'm Rick Fulbaugh.
And I'm Tracy Hutchins. Well, as the numbers continue to grow, the U.S. is just days away from a possible vaccine. The big question tonight, though, once the vaccine arrives here in Georgia, what will that process look like?
CBS 46's Melissa Stern joins us live from the CDC with what we can expect. Hi, Melissa.
Well, Rick, a local doctor says it's very important that you get both doses of the vaccine. He says this will help prevent the spread of the virus.
We are weeks away from the first round of people getting the COVID-19 vaccine.
We're looking at vaccinating frontline providers, essential workers, people who are taking care of patients in the ICU.
He says that the second shot acts as a booster.
We don't have all the information yet. If you're going to have more mutations, are you going to be more at risk to developing the disease if you only take one shot? There is some unknowns.
As of now, he says the recommendation is to get them 3 weeks apart. Frontline workers should get the vaccine by the end of the year. Dr. Patel says sometime after the new year, it will be available to the general public, depending on the number of doses available.
I want to caution you that storing the vaccine is quite complicated. You need a certain kind of freezing mechanism. You need to have it in a certain place. And so not everybody's going to be able to do that.
He believes there will be tiers and the vaccines will be given in waves to the vulnerable populations before it's available to the general public. Dr. Patel adds that a minimum of 50 to 70% of people need to get the vaccine for it to be effective in preventing the spread. And if you've already had COVID-19, you still need it, as there are false positives and negatives, and you don't 100% know your infection status.
When you have the infection, you will have waning immunity after the infection. The vaccine is meant to give you a longer type of immunity.
Dr. Patel says that your flu shots come from different manufacturers. He says it's the same with this vaccine. It doesn't matter which one you get. Reporting live in Atlanta, I'm Melissa Stern, CBS 46 News.